Good morning, everybody. I hope you had a nice Easter. This is Monday, the 13th of April. This is our daily COVID task force meeting. We're going to start by going directly to the map. So here is the latest map, and you can see that the western half of the United States is really clearing out nicely. They've got the epicenters out here on the west coast pretty much under control. Some improvement over the weekend here in San Francisco, but that is going to continue to need to be monitored. We know that New Orleans and the city of Houston, they're continuing to monitor those areas. Here in the mid-Tennessee Valley area, Atlanta North continues to require attention. And then here in Florida, we'll zoom in here. Florida is actually looking pretty good. Pinellas County, Hillsborough County, where we had the outbreak 2 weeks ago, pretty much is clearing up and trending in the right direction. Still some issues down in Dade, Broward counties, but progress is being made. All right, let's take a look at the local numbers and see how we're doing. Here in the state, we are at 19,895 with 461 deaths. So over the weekend, it increased by a couple of thousand. In Pinellas County, pretty good weekend with a count of 455 and only 14 deaths. So Pinellas County looks good. In Pasco County, it's 160 cases with 3 deaths. Across the United States, it grew pretty significantly over the weekend. 555,000 with over 22,000 deaths. The restrictions are still in place across Florida, and there's been no real discussion among the state, the governor's office, or the Department of Health of releasing any of those restrictions or beginning to loosen them up. Here in our specific zip code, the 33759, where Regency Oaks is located, we have had 14 diagnosed cases since the beginning, so over the last 40 days, and we've had 86 hospitalizations. So that went up just a little over the weekend, but continues to support the fact that the number of new cases reporting at hospital with symptoms is in fact beginning to decline. Here at Regency Oaks, we did have our first COVID positive resident test. I did send out a correspondence to all of the residents last night. That is in your box. And it changes a little bit in terms of what we are going to do and how we as a community are going to respond. And so I wanted to briefly talk about some of those steps that we are taking in order to reassure residents that we're ready for this. We knew this eventually was going to happen. It was almost inevitable, but we're prepared. We've been getting ready for this. We've been working on our supplies, training our staff, looking at our protocol, following the guidelines of CDC and the Department of Health, and we're prepared for this. We're confident that this exposure is not widespread and that we are going to be able to maintain the safety of our residents and protect the herd inoculation status of our resident population. We understand this is a very serious situation, and we want you to know that we are approaching this with the utmost level of diligence and care. It's important that you know that we have implemented the next level of our disaster preparedness plan in order to ensure that residents are safe and that we prevent the spread of the virus. We are now requiring all of our associates who are in the common areas of the building to be wearing face masks and gloves if they are in direct contact with residents. So our housekeepers and our young servers who are going door to door. We are increasing the frequency and the rigor of our cleaning and sanitizing process to make sure that surfaces are clean and sanitized. I do want to re-emphasize that the way this disease is going to be spread is not from surface to surface transmission. Yes, it is possible to contract the disease from touching a contaminated surface, but the vast majority of the exposure occurs person to person. This is at its heart an airborne contamination. It spreads through droplets from sneezing, coughing, and direct handshake, skin on skin contact. So those are the areas that we want residents to focus on. We will take care of the sanitizing of common areas, but really it's the airborne precautions that are so important. We are further restricting visitations, including our deliveries. There were a couple of key vendors that we were allowing into the building through the service entry. Those are going to be eliminated, and those deliveries will be dropped at the exterior of the service entry, and staff will make sure it's picked up and taken inside the community. We are reviewing and executing against a higher level of precautions in our emergency standards protocol, and we are executing that in our response program now. An additional step with our residents is that we are asking for you to share any travel plans with us in advance. And so we're not talking about necessarily out of city plans. We would like to specifically know if you are planning on traveling, getting on the roads, and going to a physician's office, or going to visit an adult child, or perhaps going to the grocery store. Having specific information of who's leaving the campus and where you are going will help us control and be able to track specifically where our potential exposure risks are. We're coordinating our best practices across a larger and broader network of sister communities. So every day our team is on the phone 2 times a day talking about best practices, what we have learned from other communities about the spread of this virus, and how we can best control the contamination. And then we're also making the recommendations from CDC, the health department, available to all of our associates and passing it on to residents where appropriate. One of the things that I specifically wanted to talk about is our patient zero, which is the first resident with a COVID diagnosis, and the next step in terms of residents. There, obviously, we are not publicizing the individual's name. There are privacy laws and HIPAA protection guidelines that ensure that individual's privacy. So just as we would not share your personal medical information with others, we're not prepared to share information on patient zero. I will tell you that we have made We have reported this to CDS, the Department of Health, the internal trackers set up in our own organization. We are in the process of doing a social history on the infected individual to find out who they have spoken to, where they have gone, who might have been exposed, and if there is a potential that a resident has been exposed through contact with this individual, we will be sharing that on a one-on-one basis with potentially affected individuals here within the community. I know that residents will be asking, what can I do to further protect myself and to assist? And they're the same things that we have talked about from day one. Practice good social distancing. The standard now is groups of no more than 4 and distances of 10 feet, not 6 feet. So we're tightening it down just a little bit. Regularly clean and disinfect your personal space. I know this is difficult. Supplies are hard to come by. You probably don't have Clorox wipes available to you. And so soap and water has been and will continue to be the best methodology to make sure that your personal space is sanitized and protected. Avoid touching your face. If you're out in the common areas, if you have a mask, wear it. There are lots of demonstration videos on YouTube about how you can make a mask, from t-shirts to socks to bandanas. Wear a mask. If you're out and about, don't touch surfaces, and if you do not touch your eyes, your nose, your mouth. As soon as you get back to your apartment, wash your hands or sanitize your hands. Practicing good personal hygiene is the single most important thing that any of us can do. And then finally, stay in your apartment. Our suspicion at this point is this patient 0 was probably out and about. There is no evidence that we have found at this stage to suggest that this was brought in by a family member or by a staff member. It is our early operating assumption based on the social history is that this was probably contracted as this individual was coming and going in the community, the broader community outside the walls of Regency Oaks. So social distancing, good personal hygiene, and most importantly, I know how difficult it is, but isolating yourself in your apartment is key to making sure that we get on top of this and we prevent the spread. I am confident that we're going to be able to overcome this. The staff, I'm so proud of our staff. We haven't had call-ins. The staff is aware of the situation. They are dedicated and committed to being here to protect residents and to make sure that working together, all of us are going to get through this and we're going to prevent this from spreading further within the community. So I thank you so much for your support and for doing your part in an overall effort to control the spread of COVID-19.
Brant, a few questions that I've been getting from this morning is that what is the protocol if a resident starts experiencing symptoms of the coronavirus?
So great question, Tiffany. Here is our recommendation. If you are experiencing symptoms of coronavirus, the first thing I wanted to share with you is that not all symptoms are alike. The symptoms of flu, influenza, and COVID, there is some similarity. different people experience different things. And some complain of aches and pain, others complain of diarrhea, others complain of just not feeling well. And so those in and of themselves are not adequate to make a diagnosis. One of the things that is consistent with COVID is the temperature. COVID has a higher temperature, usually 100.4 or higher, as opposed to the common flu, which has a temperature closer to 99 degrees. And so if you are experiencing symptoms, a couple of things we recommend. First, call us. We have a screening that we can do. It's a series of 4 questions, and we also can take your temperature. That will help us evaluate and make a recommendation as to what we believe is the next best step. We also recommend that you call your physician. And if necessary, we can help you with reporting to the local health department. But if you initially are experiencing symptoms and you're nervous about that, call Leslie or the front desk, and Leslie or Betty, Nurse Diane, we will get in touch with you and do that initial temperature screening, look at your history, and make a recommendation as to what we think is the next best option for you.
Brant, another question. Is it safe to visit the community right now?
So residents at Regency Oaks are practicing good social distancing and personal hygiene. And so I am very comfortable with our residents on campus. And you have done a great job in staying in small groups, keeping away from one another, still going about your business without fear or exposing others to risk. You've done a great job. The building is closed down to visitors and family members. One of the areas that still does present some concern for us is we are aware that many residents, because we are not allowing friends and family to come into Regency Oaks and visit, many of our residents are continuing to go outside. And they are either meeting individuals on the front porch or on our benches, or having small little picnics in the lawn, or going out to the houses of adult children. This is something that is very concerning. It is a high risk behavior. I hope that all of us are taking that with the proper degree of seriousness. That is the number one risk exposure for Regency Oaks, is someone leaving the herd to go out amongst others in the broader community, contracting the virus, and then bringing it back in. And so we are strongly discouraging any contact with the outside community, including your friends and your family, until we get through this period.
Brant, are you asking people who came in contact with resident 0 to also get tested?
Great question. So we are following the protocols set up by CDC, our local hospital, and the public health. And here's the way that works, and this is their current recommendation. You already know that there are not a lot of these tests that are readily available. They do have tests for people who are showing symptoms and are suspected of having an exposure. So through our social tracking in trying to determine where patient 0 has been and who they've been in touch with and what contacts they have made with others, we are doing one-on-one follow-up interviews, and we're addressing the type of contact, what protective gear did that resident potentially have, were you wearing a mask, did you step within 6 feet, did patient zero sneeze, cough in your presence. So through this process of interviewing potential residents who may have been impacted, we will then evaluate and talk about the options and recommendations. Where it starts is with increasing the temperature monitoring for potential residents who have been exposed. Instead of as you come and go, we will be asking those residents to twice a day come in and be checked and have your temperature recorded. That's the most effective means of tracking this disease, and it allows us to give an early indication of potential virus contamination. Testing is done if you are showing symptoms, multiple symptoms, and your physician believes that you potentially might have been infected. We will coordinate that with you and support you through that process if in fact you begin to experience any symptoms. Tell us early, reach out to us early. We will try to identify everyone that we think potentially could be impacted. Okay, that concludes our report for today. I know this is not the news any of us wanted to wake up and hear, but two things I want you to walk away with from this broadcast. And the first is that Regency Oaks is prepared for this. Our staff has been training and planning for this. We have the critical supplies. We have a protocol to execute against. We're confident that we're going to be able to contain this and keep it from spreading. Your safety, your well-being is the most important focus for the community at this time. It's what our staff is totally focused on, is making sure that you're going to be safe and that together we're all going to get through this. I do need your help and support. I need you to practice good personal hygiene. Practice good social distancing. Don't go out of your apartment and leave the campus unless it's an absolute necessity. Help us by making sure your family and friends are away from the community. They're safer at home as well. With your support and with the protocols that we have put in place and the guidance that we're getting from health authorities, we're going to be able to move past this. So everybody have a safe day, and we will see you again on Wednesday. Thanks.